here is your question. Yes.
Yes.
Okay. So if you have read and understood, considering it clinical examination station, kindly begin.
Yes, my name is Dr. Khawa Rahman, one of the surgical candidate. I will wash my hand. May I ask your name and age, please?
Yes, I'm Smith, 67 years old.
Okay, today I want to examine your groin area and abdomen. Is it okay?
Yes. Can you speak a little
Do
louder?
you have any? Do you have any pain? Do you have any
No,
pain?
no pain yet.
No. I will arrange a nurse or to work
Chaperone.
as a chaperone.
Yes.
And yes, chaperone. And I will expose the patient with from umbilicus to foot. But in exam, I will maintain the underwear of the patient.
Yes, to
Dignity.
keep the
I will not
dignity of the
expose the
patient.
genitalia.
Yes.
Yes,
Okay.
yes.
Right. And what
the
would be the position of the patient when you will start
patient?
examining?
First of all, patient will be in standing position, and I will do the inspection of the patient.
Okay.
I will check the groin of the patient. At least proper exposure is needed at that time.
Yes.
And I will check on inspection. I will check, is there any scar, any swelling?
Yes.
On examination, there is a swelling in the right groin. It is oval in shape, no scar, and skin is normal. And I will check the another size. It is normal. Ask the patient to cough. Patient will cough, and there is a visible cough impulse. And I will
Okay.
also examine his abdomen that there is no scar. Then
Okay.
I will come closer and palpate the swelling. Normal temperature, non-tender, not compressible, not fluctuant, and I it is 2 into 3 centimeter. Then I will ask the cough impulse again, and it is positive. I will deep ring occlusion test, and in the
How
meanwhile,
would you do
I
that?
will also
Yes, kindly
I will
explain. How would you do that, please?
I will reduce the swelling, and at the
If
level of the deep
swelling
ring,
is not
which
reduced, yes, then
if
what
swelling
would
is
you
not
do?
reduced,
Yes,
I will ask the patient to
to
reduce, try
reduce
to
it.
reduce
Yes,
by himself. Reduce
very
it.
good. Very
So
good.
if it
Yes.
is, yes, if the patient is successful, then I will occlude the deep ring that is between anterior superior spine and pubic tubercle,
Yes.
and then occlude it and ask the patient
How would
to
you
cough. In the
place your hand to occlude the ring?
it is between anterior superior spine and pubic tubercle, a few centimeters above the inguinal ligament.
Yes.
And then I will occlude this swelling, and as well as swelling will be reduced at well also visibly. So I will
Yes.
reduce, I will occlude the deep ring. And in the meanwhile, I will also palpate the superficial ring and ask the patient to cough. So I will manage to know that it is deep ring occlusion test or a direct hernia or indirect hernia.
Yes.
Then I will
Considering the
check,
age of the patient, what do you think would be the most likely?
it is the
type of hernia?
direct inguinal hernia, and I will
Okay.
the deep ring occlusion test will be negative, and it
Yes.
will be the direct inguinal hernia. And after palpation, I will check the another side of the patient, the standing position. And if the hernia is big enough, then I will also big enough, then I will do the percussion, and I will also ask the patient to show your his scrotum, and I will check is the hernia is radiating to the testis scrotum or not. And I will also palpate that the testis is separately palpable, swelling is separately palpable. Can I get above the swelling or not? And the similar thing I will do the another side of the groin. Then I will ask the patient, if I have time, then I will ask the patient to lie down, and I will do the abdominal examination, proper abdominal examination, and I will auscultate the swelling, and then I will do the digital rectal examination. In abdominal examination, I will do the superficial and deep palpation, and I will check any mass, but where is spleen and UV bladder, and I will finish my examination.
All right. What else would you do to complete your examination? Since you still have 1 minute and 30 seconds.
I will check the chest examination. I will check the urethral examination. That is there phimosis, any ulceration, anything else, and digital rectal examination to check the posterior.
Digital rectal examination you'll mention at the end, but you won't be doing it. Okay.
Yes.
Any other orifices, maybe, because it's hernia, so or the
penile orifice, madam.
Yeah, okay. Right. So if 1
Phimosis,
minute is still remaining, but can you summarize your examination now, please?
This 67-year-old Smith has a swelling in the right groin for 2 months, and this is oval in shape. It is 2 into 3 centimeter, and cuff impulse is positive, but and overlying skin is normal, no scar, and deep ring occlusion test is negative, and it is reducible, and it is not compressible, not pulsatile, and abdominal examination is normal.
Yes.
And is.
So what are your provisional
on
and
auscultation
differential
bowel
diagnosis?
sounds are there.
Okay, on auscultation there were
My
both
provisional diagnosis is direct inguinal hernia, and other maybe right inguinal, indirect inguinal hernia, femoral hernia, lymph node enlargement, sphena varix, and hydrocele may be there.
Okay, how would you confirm your diagnosis?
My differential diagnosis.
How would you confirm your diagnosis?
This hernia examination is mainly clinical, but if I have a doubt, then I can do the ultrasound of the groin and abdomen, scrotal region.
Yes. Okay.
Yes.
What do you expect to find?
I find in this case that is a direct inguinal hernia. There is a weakness of the fascia posterior abdominal fascia transversalis. So there is a gap in the defect in the fascia transversalis. Okay,
good. What are the management alternatives that you can offer to this patient?
If the patient is fit enough, then I will proceed
for this particular
operation.
Patient. Yes.
This patient, I will offer him the operation, and this operation will be laparoscopic or open operation, and I will offer Lackenstein repair if I am going for open operation. Otherwise, the laparoscopic approach, this trans-abdominal periperitoneal approach, and total extraperitoneal approach with mesh.
Okay, can you please tell me what are the indications for laparoscopic hernial repair?
If it is if the patient wishes, patient choice, and if it is bilateral inguinal hernia,
if it is bilateral, yes.
Recurrence of the hernia,
yes, and recurrent. And if patient for the cosmetic reason, scar will be less. Okay, right. You told me the open repair as well. Would you or would you not recommend for this patient mesh repair?
Yes, mesh will be must. Mesh is essential.
Is it for all the patient or just for this particular case? No,
madam. If there is infected hernia, gangrenous hernia, then I will do the, I will not place mesh. I will do the Bassini repair or redo operation. This type of operation I will do.
Okay, right. You, bell has gone. Very good. Everything was very nice. Inspection, you did everything. You asked for chaperone. You exposed the patient adequately enough from umbilicus to feet. And then, yes, since it was unilateral hernial repair, so yeah, could have been direct, but then My one question is, okay, inspection was all right, it was good. Palpation was also good. When I was asking you what else would you do, then to complete your examination, I wanted you to tell me that you will look for the associated inguinal lymphadenopathy. So you rule that out if there is any infection or not. Then maybe you can also do the elimination test and the measurement of the size of the hernia. And you did tell me, but you did not do auscultation. You did say that there were bowel sounds present.
Yes, madam.
Yeah.
Yes, madam, in transillumination, if it is radiating to the scrotum, then I will do the transillumination.
Yes,
But if it is small, I can't do the transillumination. But I will mention to examiner that I will do the transillumination if it is big enough. But
big enough, or because you mentioned other differential diagnosis as well. So in order to rule them out, you can do that. But this is like to complete your examination, you can add these.
Yes, madam. And madam, if the time allowed, I will ask the patient to supine position and do the proper. I will start the proper abdominal examination or just palpate and
just you'll mention it that if time allows me, then I'll do the complete abdominal examination and the chest examination. But you won't be doing it, okay? Because if a patient is there, normally the patients are the real patients, real elderly patients, and they do have hernias, right? And then you have to examine the patient both sides. Then you won't get in 6 minutes, you won't get enough time, but then you should be able to mention it at the end that how you'll complete the examination.
Yes, madam, I
right.
understand.
Can you quickly tell me what is modified Bassini's herniorrhaphy?
In this, I will stitch the inguinal ligament to the conjoint tendon by proline.
Yes.
20.
Yes.
That is quite modified Bassini.
Yes,
and the simple Bassini, I think it is the inguinal ligament to fascia transversalis.
Yes, good.
That is the Bassini.
These are the common questions that can be asked. Otherwise, yeah. Good. Thank you.
Okay, madam. Thank you.